Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And welcome back to another episode. Dr. Ashley and I explore 3 more great programs on today's episode, as well as bring attention to May is Mental Health and Awareness Month. As you may have heard before, the board funds 50 programs and services through our contract partners, Appleseed, Acada, and Catholic Charities. And since we think most folks in the community don't know that or what they are and how to access them, we thought it made some sense to spend some time unpacking each of these programs, a little bit about what they do, how they can be accessed. So I hope you enjoy today's episode. Good morning, Dr. Ashley. Here we are again.
Here we are. Good morning.
Keeping Ashland Healthy. Good morning. Thank you all for listening to the Mental Health and Recovery Board's Keeping Ashland Healthy podcast. We enjoy bringing this program to you on a regular basis. And we are in a pattern, Dr. Ashley, because I had mentioned to the audience, we had actually both together a few weeks ago, that we have 50 funded programs through our 3 contract providers, Appleseed, Catholic Charities, and Acada. Mm-hmm. And I would imagine most people don't know that we have 50 programs or what they are. So it made some sense to us to maybe try to unpack in a relatively brief period of time, try to unpack some of the programs. I've been calling these 3 great programs, 3 more great programs, yet 3 more great. So until we get to the 50. So we will work our way through all these great programs that the Mental Health and Recovery Board funds because obviously, a great program is only great if people actually access it when they need it. So if you don't know about it, you won't access it. So that is partly, obviously, what the Mental Health and Recovery Board is all about is making the community aware of some of these resources that we do have available, how to access those quickly so that they can get their needs met and or their loved ones' needs met. So without further ado, we're going to talk about 3 kind of intensive services and then a service for our veterans, which, again, there's not always a whole lot of overlap between programs that the board funds and veterans, just because their funding typically comes from the VA, which is a separate funding entity and planning entity than the board. But there is some crossover that we've been trying to make. So we wanted to talk about one of our veterans programs. And then May is Mental Health Month, Dr. Ashley. Yeah. I can't believe it's almost here. So we want to talk about a few of the things that we are promoting during the month of May. So let us start first with what is sometimes called detox. That's the old term, Dr. Ashley.
Yeah.
Because I don't know, it got a bad reputation, detox. But now, audience, detox is not called detox anymore. It's now called withdrawal management. Mm-hmm. And the thinking behind that is withdraw from drugs, and it could be many different kinds of drugs, but primarily opioids recently, or amphetamines or other drugs. You might recall at our conference, we talked about psychiatric drug withdrawal. Drug withdrawal is a thing, and it can be very, very challenging, and it needs to be managed and medically, as well as with counselors and social workers, primary care physicians. So that's I think the rationale behind withdrawal management. Mm-hmm. I think that maybe better, it sounds more sciencey.
Yeah, maybe so.
Right? And detoxification.
And we can't forget alcohol.
Yes.
Withdrawal is one of the most dangerous forms of detox.
That is correct. So withdrawal management and then residential services. And we're particularly talking about individuals that are struggling with substance use. Withdrawal management tends to be much more short-term, from a few weeks to maybe 30 days or so. And then residential services, as the name implies, for substance use could be a bit longer, could be some months or more. And one of the questions we get a lot, Dr. Ashley, is does the Mental Health and Recovery Board fund, or does Ashland County have within the county either withdrawal management services or residential services for people struggling with substance use disorder? And the answer is...
What's the answer?
No. No, we don't.
No.
There's a lot of reasons for that, but the short one is we don't have enough sufficient need from Ashland County residents alone to stand up services like that. So the next best thing is to have those high quality services available within a short distance. And luckily, we do have that in a partnership with Ashland County and Catalyst. They have both withdrawal management and residential services about 25 to 30 minutes or so away, depending on where you live in the county.
Yeah, so those services are still available for people in Ashland, just not in the county.
Just not in the county. So I say that because I want loved ones or the individuals to know that. And we have an agreement. We're in regional collaboration with other boards such that it should not cost the individual, if they don't have insurance that could cover it, it should not cost the individual anything to access those services. Yeah. I can tell you historically, we work with Rick Ford. He's the gatekeeper in the county. I say that because sometimes folks want to go on their own or help their loved one go on their own to get those services. And I can't say this clearly enough. Please don't do that unless you've got a lot of money. Okay. Yeah. We have worked out arrangements for the funding, but you need to go through Acada and Mr. Ford to access those. Rick has to do an assessment and really make sure that this is the right level of care, because it's the most intensive level of care for somebody who's struggling with substance use. So we need to make sure folks are ready for that level of care, because it is extremely expensive, but we can get you in at no cost. But you need to go through Mr. Ford. If you just show up and say, hey, I'm from Ashland County, I heard Dr. Ashley and the boss on the Keeping Ashland Healthy podcast talk about this, admit me and don't charge me anything. They're not going to do that. They're not going to admit you. They have to have Rick Ford's assessment and through Acada to get in. So just call Rick at Acada. He does this all the time. He's what we call our gatekeeper for those services.
Yeah, that's great.
So now, how does it work? People say, well, what should I expect? Well, with withdrawal management, it's not uncommon. Maybe I'll just take opioids, Dr. Ashley. I know people aren't, withdrawal management hasn't been used as much for opioids here in the last couple of years as it was in the previous 3, 4, and 5 years, where we used quite a bit of it. But basically, the person would go in initially, withdrawal management for opioids, go through that process, and then they might transfer over to the residential services for a period of time, and then they would get discharged into outpatient services within the county. Yeah. Now, the nice thing about what Catalyst has set up is the withdrawal management and the residential, they're like right across from each other. They're like their own little compound.
Yeah, that's nice.
Yeah, and it's really convenient for those that are visiting them. They're both right there. It's in a nice part of town that they have this set up where I think it's very peaceful. So anyway, we're pretty happy with what Catalyst is doing over there. We love that it's so close to the county since we don't have it in the county. But yeah, I just hopefully, folks, that gives people just a better idea what to expect and what to anticipate. And again, if funding is an issue, and it is for a lot of people, just go through Mr. Ford. Let him be the gatekeeper for those services. Make sure you really do meet that level of care criteria before going over there, and he'll help facilitate that.
Yeah. So one question I think listeners might be wondering is, why might someone need detox or withdrawal management? What do you think about that?
Yeah. And not everybody does. That's a great question, Dr. Ashley. So how do I know I need that? That's what Rick helps you decide.
Yeah.
So
Okay.
some individuals don't need to go into that level of care to get outpatient services and be successful. That's the whole point.
Yeah.
Do I need withdrawal management residential? Not necessarily. Why don't you sit down with somebody like Mr. Ford that's got 30 plus years experience and expertise in this? Let him walk you through some questions to figure out what would make the most sense.
Yes. And I think so when you withdraw from a substance, it can be very uncomfortable, painful.
Yes.
You can be very sick.
Yep.
Right. And so sometimes you just need a higher level of care to get through that process.
Absolutely.
Sometimes people will go through withdrawal, and in the process they can't handle it, and they'll just continue using again. Yep. So it's a way to help get people to the other side of that withdrawal too. Yep.
It's very uncomfortable, as you say, and that process, if you do that on your own and by yourself, and it's very uncomfortable, right, you may not be as successful as if you're in a controlled environment with supports, with help, with sometimes medications that come alongside short term during the withdrawal process to make that withdrawal easier.
Yeah.
So It is, I think, recommended for certain folks, but not all. So that's why that assessment is so important.
Critical, yes.
Yep. Well, our next intensive service that we want to talk about is actually the gatekeeper's Appleseed, not Acada. And this has to do with individuals that might be struggling, thinking about harming themselves or others, or just in a mental health crisis, as opposed to maybe a substance use disorder crisis. So mental health crises are more common than maybe people know in Ashland County, Dr. Ashley. We were just looking at the numbers for this year. I've got them here in my hand. It looks like we're going to get just a little over 900 folks that get what we call a crisis assessment.
Yes.
And, you know, of those 900 folks in the county, that there might be some duplicates in there. But again, roughly 900 individuals that might be in such a crisis, mental health crisis, that they need a professional assessment by somebody at Appleseed. The vast majority of those folks, about 50%, they get assessed, and then they are, discharged usually from a hospital setting, ER, so not even admitted, so they'll just be in the ER, assessed, and then released back home or go back home with follow-up services either the same day or soon thereafter. Most folks can receive the help they need that way. The reason I guess I'm bringing that up, Dr. Ashley, isn't for our audience members listening. They might think from watching movies or reading books that if you go to the hospital to get assessed because you're struggling with a mental health issue, that you're going to go to the hospital. And I just want folks to know that is rarely the case. Right. So what I mean by rarely. So our numbers are pretty consistent year over year, and we get these from Appleseed. About 1%, maybe 2% of all the people screened will end up going to the state hospital, which is over in Massillon. That's a pretty small number of folks, and that's been holding steady for many years now. Another 7 or 8% of all the folks that are screened might end up in what we call private psychiatric hospital, which again, do you know how many private psychiatric hospitals we have in Ashland County, Dr. Ashley?
0.
We have 0. So again, for the same reason we talked about withdrawal management and residential, we just don't have the number of individuals in the county that need that level of care. Yeah. But they access it through psychiatric hospitals that are nearby. I will say, unlike what Catalyst is doing, sometimes we've used Ohio Health, which is next door, but more often than not, when we have to admit somebody to a private psychiatric hospital, it's a little further away, like Ohio Hospital for Psychiatry. It's usually in Columbus, that area, up in the Akron area, Summit County, perhaps. Yeah. So there is a little bit more of a drive involved with that. I just wanted the audience to know that. But again, you're only talking about 7 or 8% of all the folks that are screened in a year that need that level of care.
Right. And it's really only if they're a risk to their own safety or someone else's. Right.
Correct. So I think that's important to know, because it's not that we want to underreact when somebody's experiencing a crisis, but we certainly don't want to overreact. And we talk about restrictive levels of care, most restrictive levels of care, which are inpatient kind of psychiatric admits. We don't want to put folks in those situations unless it absolutely is warranted based on all the available information and the best clinical guidance of the team working with them at the time.
Absolutely. I think so. A lot of times when someone's struggling, just having that support, like being able to have the pre-screen done and talk to a professional, that in itself sometimes is enough to de-escalate the situation. Yeah. And just knowing that they have some resources going forward keeps them out of the hospital.
And both Dr. Ashley and I, when we weren't bureaucrats, which that should be a good book title.
When we weren't bureaucrats.
When we were in direct practice, both of us did crisis services. Both of us did these assessments that we're talking about. And, and one of the critical elements whenever you did an assessment and you did facilitate helping somebody get into one of these psychiatric hospitals, whether at the state or the private, was, we were always thinking about what needs to happen there to minimize the length of stay, not minimize it for non-clinical reasons, which is what sometimes we have to do now just because of overcrowding. But for clinical reasons, how long really is reasonable for the person to be in that level of care, that very high level of care? So we're discharge planning from, your initial admit, we're trying to do discharge planning, as you said. What needs to be in place when the person gets out? Where are they going to go? Who's going to be involved with their care and their treatment? What services weren't they getting that, maybe would be more helpful, et cetera? What happens in the hospital, like a medication that might be added? Should that be continued when they come out? Should it, for how long? And what type of medication? Is that going to be covered by their insurance, or are they tolerating it well? Or there's just so many things around discharge planning, but we do that as soon as they're admitted. I know that sounds maybe odd, but as soon as people go in on day one, we're trying to figure out, how to get them out, because we don't want to keep them there any longer than they need to be there.
Yeah, I mean, we believe like the hospital is not the most fun place to be, right?
Not normally.
And you can get a lot of support and services in the community. So the best place really is in the community.
Absolutely. So guess what? The board feels so strongly about crisis services. It is our number one priority service.
Love that.
Yep. So they felt so strongly about this. Again, we may have mentioned this position before on the podcast, but the boards invest some of their dollars in a hospital liaison at Appleseed, and really her whole job. It is a female, so I can say that. It always has been, actually. I think about the history of it. Yeah. Her whole job is to make sure everything we're talking about right now goes as smoothly as possible for the individual and the families impacted.
Yep.
So she makes sure that the admissions, the length of stay, she makes sure that hospitals that we're placing folks in and working with, we would put our own family members in, because again, that's the standard. If I wouldn't put mom, and you've met my mom, I'd hate to put her in a hospital, but if she needed it, where would I put her? Where would I feel comfortable placing her? So that's our standard. If we wouldn't feel comfortable with our family and friends there, maybe we need to be contracting with a different hospital.
I love that way of thinking.
Yep.
Yeah, absolutely.
So I want folks to know, I guess if you're a loved one or you're the individual that might struggle, please know first and foremost that it's very unlikely that you're going to end up in a state hospital. And even if you do, it's not what you've seen on TV.
Right.
Yeah, even though these might be locked facilities, it is not one flew over the cuckoo's nest situation. There is no Nurse Ratchets that I'm aware of.
Yeah. Geez, I hope not.
Folks tend to be much more health, wellness, positive in their focus. They understand that folks are there for usually a short period of time before they move out. And they're just trying to stabilize the situation and get them to where they need to be so they can be successful. But that's going to happen on the outpatient side.
Yeah.
So hospital and inpatient services, and those are gatekeepers, are Appleseed, and I just wanted folks to know a little bit about that and a little bit about the numbers. I thought it'd be helpful to know about the numbers, but we say this a lot, Dr. Ashley, when we do our QPR trainings, but individuals that are in crisis at a level where they need this kind of screen and possible placement, that tends to be a once-in-a-life experience.
Yeah.
It usually is, for an individual, it's a convergence of a lot of stressors all hitting at the same time. So it could be employment, it could be personal, it could be physical. Several things are all bearing down on the individual at the same time, and their ability to cope and manage is overwhelmed, and they get into a point where they're not sure about what to do. And they can be in such distress that this kind of assessment and then treatment makes sense. But as I say, for the vast majority of people, that's a once-in-a-lifetime experience.
Yeah, they get better, and,
Yep.
and they don't experience that again usually.
Yeah,
So.
and I say that because I want folks that are listening to don't hesitate. If you or a loved one is experiencing that level of stress, reach out. Call the 24/7 number that we talk about all the time on this program, and we work it into our intro and our outro, the 419-289-6111, because we don't want folks to be shy about using that number.
Yeah. I think that's great too. You said like 800 or 900 people in the year
900.
will actually call for that. So I think that's great. People are using the hotline.
Yeah, no, that's the 900 are actually the assessments.
Okay.
The actually
So
hotline calls we're in thousands. Thousands of people call the hotline. We should do another episode just on that.
We should. I think that's great. People are open to using it.
Absolutely. We have a lot of folks that call the hotline. But yeah, the 900 is actual assessments.
Okay, gotcha.
Yeah. Our next, let's pivot real quick. I had mentioned a unique peer program that the board funds here in Ashland County for veterans, and it's our what we call our landing zone. They call it that, the landing zone. It meets on Wednesdays over at the professional building from 8 to 10. The landing zone meeting is a peer peer-to-peer veterans program. And what I mean by that, it's informal in that basically we make sure that the room's available, it's clean, it's lit, there's coffee, there's donuts for the vets. They run it themselves. They decide the topic areas and best way to address the issues that they're going through. Because we've learned, Dr. Ashley, over the years that vets helping other vets, these peer-to-peer programs can be highly effective and work better than sometimes bringing in somebody who's not a peer that maybe has a lot of great information but isn't a peer, and it's not always received as well. And as I said at the top of the podcast, the veteran services, the vets typically get most of their services paid through the VA. So they're not usually going to our contract partners, Appleseed, Decatur, and Catholic Charities. They're usually going to VA hospitals and clinics. So we don't have the direct relationship on the clinical side, but we wanted to have at least some role, some way to support our vets. So this peer-to-peer program, the Landing Zone, was a way for us to do that. And we're glad because we have on any given Wednesday, there's about 20 vets that get together.
That's awesome. Yeah, I love that.
Yeah, I love that they get together. I love that they're in charge of the agenda and they manage it. They help each other. They support each other.
Yeah.
Different theaters, different conflicts over different time frames. So from Korea to Desert Storm to Vietnam, there we have a few from that era. So yeah, it spans the different wars or conflicts. So that is the VA program. It's through Catholic Charities, but they actually meet in our large conference room at the professional building. And for folks that don't know, that's on the entrance is on Church Street, which is that little cut through street between 2nd and 3rd Street. Yeah. So, I'm looking at Dr. Ashley, just nods her head because she's not from the area and refuses to learn.
I actually knew what street you're talking about that time. Progress.
Progress. Right across from the courthouse.
I'm learning 4 years in.
So last but not least, Dr. Ashley, those were our 3 great programs. We wanted to talk a little bit because we're getting real close to May. Yes. And May is typically one of those, every day is a special day for somebody. And there are all kinds of events and celebrations out there for every day of the year. It's actually very overwhelming. And similarly, there's a month for every cause, event, et cetera. So
I can't keep up with it.
I know it is hard to keep up.
But this one's important for us.
Yes. So May is Mental Health Month. It has been around for quite a few years, for whatever that's worth, audience. It has been around for a while. We did not make this one up. Not like some of David's made-up holidays. But there's a few things that are going on through the month of May. And again, why Mental Health Awareness Month? The whole idea is we believe, that's why we're doing the podcast in part, is that we think it's impossible to really have a good quality of life if you have a poor quality of mental health. So mental health wellness, emotional wellness is key to that. So we want to draw attention to that issue, the critical component that is mental health awareness and mental health in general. So we do that. Several different things are going on in the month. We are going to have a newsletter. Sandy Hoffman here at our office works with us and our other partners to assemble that. It's a good comprehensive newsletter that'll get released right at the first of the month with a lot of the information we're talking about. If folks aren't already on our mailing list and are receiving that, please, what's going on? Call us, 419-281-3139, or just go to the website, Ashland, mhrb.org, and sign up for the newsletter. And again, we'll put this information in the episode description. If you're driving, you can pull over if you want, but you probably need to get to where you're going. So, but yeah, get the newsletter, sign up for the newsletter. And then May 7th is one of the events we're doing, Question, Persuade, Refer. Down with Step 2, that's obviously a large manufacturing company in Perrysville, South County. You did the first Step 2 training QPR a year or two ago. I can't remember, was it last year or the year before? But anyway, you did that, and kudos to the company, the leadership there, that they said we want to have this on an ongoing basis.
Yes, and this one is for their management team. Awesome. So I think that's great.
Yep. So we'll be doing that training, 2 shifts. I think one in the morning, one later on, to try to get all 3 of their shifts.
Yes.
May 14th is the Senior Health Fair. Ashland County Council on Aging is the lead on this. It is not I think too much of an exaggeration to say we'll see over 600 seniors.
Oh, yeah. That's a
show
big
up.
event.
It's
Yeah.
at AU at the Convo, Upper Convo. There's a kind of a tabling opportunity for a couple hours in the morning, and then there's a nice lunch with some entertainment and some giveaways. So that's a day. So if you are a organization that's listening to the podcast that serves seniors in any capacity, and you've not been involved with the tabling piece of that, get a hold of, I guess it would be Nicole
at the Council on
on the
Aging?
Council on Aging, so you can get a spot. They may all be gone, but if double check, and if they are, you just need to get in line for next year, because it's a wonderful opportunity to get information to seniors in Ashland County. May 17th, our good friends over in Richland County, Jeff and Donna Heck, are doing their 33 Forever birthday walk in honor of their daughter Danny that they lost to suicide some years ago. We always table at that because there's such a crossover between Richland and Ashland County in terms of people that live and work between the two counties. We love supporting that event, so we'll be over there May 17th. That's down at the Carousel District right downtown, and that carousel music, Dr. Ashley, the first hour, I liked it. The third hour, right.
Didn't they have snakes last year? Was that a thing?
There's a lot of vendors that show up, including some folks that bring the snakes. Yeah.
Yeah, that's why
kids like that.
Not able to
lizards.
Make it.
There's snakes.
Lizards are cool.
There's all kinds of amphibians there. There's always a great turnout for that event.
Yeah, that's awesome.
Appreciate Jeff and Donna. They always support our suicide and awareness walk that we do later on in September.
Yeah,
we certainly support their work, bringing attention to the issue of suicide, but also just to crisis care and emotional health and wellness.
And isn't it's on their daughter's birthday?
Yes.
Their daughter that died by suicide at the age of 33, and that's what the organization's named after.
Yep.
Yeah.
Yep.
I love that.
Also on the 17th, so folks might have to make a decision. I don't know if they can do them both. One of our partners, Appleseed, one of their programs is the Safe Haven program, which is their domestic violence, intimate partner violence program. Safe Haven has a Run with the Stars 5K. Now, Jerry Straswell, the executive director, has clearly said you don't have to run. You can walk. You can skip.
He did
and
say
he
that.
said, I think Jerry was quoted as saying, in fact, you don't have to do anything except give us your money if you just want to sit there, which I thought was great.
And you get a T-shirt,
right?
which is pretty cool.
Right. So, but if you want to run, skip, jump, sit with the stars, 5K, Ashland Fairgrounds, that is, the Safe Haven is a program of Appleseed that starts at 7:30 at the fairgrounds, May 17th. The Ashland County Sheriff's Office, I know, sponsors that. They try to make it fun. They get some of the staff. They're in competition with each other.
They get competitive.
They are. They've got some great, I think, videos on Facebook. I've seen it on social media how the rivalries.
They're prepping now.
They are. And again, a lot of this, Dr. Ashley, will we be for the month as we continue to advertise all the details. I won't be able to put all of these in the episode description, but I will refer folks to the website. But then you said something about social media.
So, we're also going to be sharing information to raise awareness about mental health related topics and also reduce stigma, which is kind of the state's theme this year, is reducing stigma.
Yeah.
So we'll be sharing some information on our Facebook page and Instagram. So if you've not followed and liked us on those things, please do it before May so you can get that information.
Yep. Awesome.
So.
Well, Dr. Ashley, again, 3 more great programs, plus May's Mental Health Month. We're excited. We're always excited, though, here at the Mental Health
We've only got 30 more to go or something.
Right? Well, stay tuned, audience. We do appreciate you joining us week in and week out for this program. Hopefully, it is helping to raise your awareness of not only the issues of mental health and emotional health and substance use recovery, but also the services available and how to access those.
Yes. Thanks so much for listening.
Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.